Hello, everyone, and welcome to our webinar titled Experience Your Future, The Importance of Shadowing and Observation Hours. Today's webinar is hosted by the American Dental Education Association, the American Association of Colleges of Pharmacy, and the American Physical Therapy Association. Our speakers include representatives from dentistry, pharmacy, and physical therapy, as well as a health professions advisor. While this webinar is tailored to individuals interested in applying to any health professions education program, please note that each profession and each school will have different requirements surrounding shadowing and observation hours. We hope this information provides you with some helpful tips and advice to get you thinking about how to experience your future career. As a reminder, this webinar will be recorded and shared with all registrants. Without further ado, I'm going to pass this over to Lynn Youngblood from the University of North Georgia Department of Physical Therapy to kick things off. Lynn?
Thank you, Katie. I am the admissions coordinator and advisor for the University of North Georgia. Okay, what I'm going to discuss today is what shadowing and observation hours are. These hours are acquired while you're in the doctor's offices, nursing homes, skilled facilities, inpatient, outpatient settings, pharmacies, and there's many other areas. Most medical professions require or recommend shadowing hours. The shadowing hours can be volunteering or a paid position. Each school will have their own requirements. Observation hours give you a sense of what it's like working with patients and working with other healthcare professions. And this is the best time to actually make a decision if you think this is indeed the healthcare area that you want to be in. So where do you begin? You start with your local physicians, dentists, physical therapists, and other professionals. Then you explore the shadowing opportunities at a variety of healthcare sites, such as large and small hospitals, urgent care centers, private clinics, community health centers, assisted living, nursing facilities, hospice centers, and pharmacies. And again, there's so many other areas. So when you start to reach out to get these shadowing and observation hours, you can send an email or better yet go in person to these clinical areas. If you do decide to send an email, please be direct and brief in your emails. Also attach an updated resume to give to the physicians with more information about yourself and your background. Also, when you go in person, make sure that you have an updated resume to share with them. So each setting observed may have specific requirements. So when you're speaking with them, planning to set that time up, make sure if you have to get anything done prior to starting that time, you have that completed. For instance, a hospital setting, some of the things they're going to request is a TB test, immunization form, and flu vaccine. Additional examples of things that may be required, it will depend upon the setting. It may be wear professional attire. If you're shadowing a surgeon and have the opportunity to observe in an OR, you may want to ask, do they have scrubs available for you? If they do not, then you may need to purchase them. Your fingernails should be cut short. And this, for physical therapy in particular, free of polish or at least a neutral color. Wear closed-toe shoes, not only because it looks more professional, but because in any hospital or clinical setting, you could be exposed to liquids, chemicals, sharp objects as in needles, and you need to keep yourself safe. So when you begin to be with the patients, you want to be discreet and inconspicuous as possible. There will be situations where a patient may not want you in the room. If that's the case, just be respectful and just step out quietly. During the time that you're with the patients, be observant, ask questions at the appropriate times. You may find that during the rounds, it's very busy because of the high patient volume, whether it's in a hospital setting or a clinical setting. If that's the case, you should not interject the questions during that time. It could take away from the patient's care, and it could also frustrate the physician that you're working with. And honestly, that's the last thing you want to do, because you need to be building a rapport with that physician. And just remember, this is not just a chance to learn about a field of medicine. It's also a unique opportunity to show your enthusiasm and respect for that medical area. And Katie, I will turn it back to you.
Wonderful. Thank you, Lynn. Next up, we have Stephanie Perry from Augusta University Dental College of Georgia. Stephanie?
Okay. Thank you. Now that we've had some information about where do you begin when it's time for you to start shadowing, let's go and elaborate a little more about how many shadowing hours is required, and what type of settings you should pursue. And then we will kind of finalize my segment in talking about tracking your hours and putting this type of information on your resume. Okay, first we're going to look at it because we truly, with any of these healthcare professions, we don't want you to downplay how important it is to be around the job. So I always tell my students doing presentations that this is not like a 2-week, like a Burger King or Jiffy Lube job. It's a job, the titles are always used. And it's something that you're going to be pursuing and be doing for a long time, hopefully. So you want to really, the shadowing is really for you to confirm and to see that this is a career that's going to be ideal for you. So, not to be impartial, but because I'm in the dental school, I just want to talk about, as you're shadowing, what are some of the things that you're looking for and you're comparing. As I'm watching this dentist and as I'm watching these other healthcare professions, here are some of the characteristics that is necessary to be good at this job, and do I have those? So as far as dentists, as you're watching, you want to see how detail-oriented that they have to be. If you look at it and you're really up and close and personal in your shadowing experiences, they are in a small area, meaning a mouth, and working with a small area, meaning a tooth. And then you have to also know in that action, before or even after, that they must have good communication skills as they're interacting with their patients, with the hygienists, or even the dental assistants that are standing around that. And I'm pretty sure that's the case for any of the healthcare professions. And then also, for those of you that are getting ready to start filling out the EdSAS application or any other application, there is a very specific question that asks about manual dexterity. Those are any things that you've chosen to have good hand-eye coordination. So start thinking about those things if that's going to be a question on your application to your particular health profession program. Then leadership and being organized is something that, as you observe and watch your dentist and his surroundings and people that make up that particular healthcare team, to see how important that those things are. Some of our students ask about physical stamina. When you're thinking about it, you're bending over a lot, and in carpal tunnel, there's different things that can happen with your hands because of the physical things that are required to be in your particular dentistry or in any other healthcare profession. Okay, quickly, this just talks about, yes, it's important, but there are other factors that you also need to look at as well when you say, what does it have to do with shadowing? Shadowing is a part of it. But don't think that just these things that I'm talking about right now is just it and shadowing isn't important. Yes, admissions committees, they do look at your grades. They do look at your standardized tests. They do read your letters of recommendation. And they also look at your community involvement and other non-cognitive things and life experiences that you have been a part of. But in the midst of that, and I always speak with people, everything about the process isn't rosy, but I also have a lot of talks with a lot of applicants that were unsuccessful in getting accepted. And sometimes they can be very stellar in all these things that I just pointed out that you see on this slide and not have enough shadowing or enough experience with that healthcare profession, meaning a dentist. So those things mean they can be rejected just based on that alone. So we feel like you're very smart and very involved and very well-rounded, but don't know enough about the profession because you haven't seeked enough shadowing experience, and it can be the issue with you not being accepted possibly into a program. Now to answer the real question, how many hours? It varies. What you need to do first and foremost, if you're interested in applying to 5 schools or 2 schools or 10 schools in your health profession of choice, make sure you have notified those schools and reached out and you ask them what is the average number of shadowing hours. They vary. I know there's some schools where 40 for dentistry is the average, and for DCG, my dental school, the average is 300. That's extreme, but that is our average. And so if you were to not reach out to us and think that 40 is good, then I could slightly see it not going successfully for you. So make sure that you contacted the school and you know exactly what it is that's average so you can make sure that you're a competitive applicant for that program. Do all your hours need to be with one person? Personally, I think not. I think you need to get a variation of that. Some of that will be with general practice dentists or people that's in a generalization of that health profession. And also choose and spend some time with some specialists. It may be to rule that specialization out, or it may be, hey, I'm slightly more interested in that than being a general dentist or being in the generalization of a health profession. So make sure you spread it out get different variations. And sometimes that may be, sometimes especially in dentistry, it may be several dentists under one roof, under one particular practice. And then sometimes it may require you to go to multiple locations. But all this is for you to get enough experience around these particular dentists or health professions to make sure that you can see yourself being that particular profession. And what are some of those settings? Usually the best place to start is with your dentist, and usually you'll find that they're intrigued that you're interested in the profession, and start there as far as shadowing. And I know some of the speakers later on are going to talk about how that can be a challenge with getting somebody to allow you to come in. Then you also have the opportunity to volunteer, whether it's in public health settings, whether it's even at a dental school. For those of you who may have the opportunity to do a summer enrichment program, oftentimes that allows you to do some shadowing within the school, within the clinics. Those are some of the enrichment programs. Some schools would allow you to just come in and shadow in the clinics. I know we don't. Otherwise, we just have people just shadowing all the time. We try to remember that it's a learning institution. Then sometimes if you're not able to get in and see the interaction with the dentist and the patient, don't take for granted the dental labs and the labs, the behind-the-scenes things that are still part of the whole process. So we do have students who have worked in a dental lab. The pros to that is you get great hands-on experience, which is very beneficial to you as a D1 or a D2 dental student with first and second year. However, you don't get any interaction with a patient. And then people have the opportunity to take mission trips. Mission trips also often sometimes they have people that are interested or in the medical field. They have PA, nursing, maybe some physical therapy, maybe pharmacy, but definitely some dentistry as well. And so you can see how third world type public health is different from even the public health dentistry that you've done in the U.S. or in your particular state. And so how do you keep track of all of that? Whether you have talked to a school or interested in a program that doesn't require tracking, I recommend that you do just for several reasons. And we'll talk about the reasons why. But what you need to do is just create a log. Make sure you put the name of the facility, the actual practice where it is, whether it's Small Smiles or Christ Community Center or Dr. Jack Johnson, DMD, or whatever the marquee, the name is on the marquee. Make sure you have documented the date in which you were there. So if you go every Thursday and you're there 4 hours every Thursday, then go ahead and elaborate and tell how much time that you spent there. Specify the different activities that you've done. So if you simply was just observing from afar, or I saw some extractions being done, or I saw this type of activity being done with exercising or flexibility, Make sure you are very in detail about it so it'll help you when you need that information later. And actually write down who the person that you shadow. So for those of you that are interested in dentistry, was it the dentist? Was it the hygienist? Was it the office manager? All this is, was it the assistant? All these four are the four key players to making a dentist practice successful. And then in the point of watching and observing all of this, you got to make sure, can I see myself in this role? And then get a signature from the supervisor. So maybe that'll show them that you're very serious about this. And who knows if a school may actually require that, and then you'll have it just already. And back to this slide, I know you said, well, why are we looking at that twice? Because all this comes full circle. The point for having these tracking things documented, because it will help you in completing your application. I know for a fact that the ADSAS, the ADIA application, is very detailed, and they ask very specifically, where have you shadowed, when did you shadow, how long, and what type of things did you observe? And you're not going to remember that. So if you already have that document, it's just easier to relay that information back over to your official application. And for some programs that require you to present a resume, or even if you have the resume that you're presenting to people who are writing your letters of recommendation, now it's easier to fill that component out so they'll know that you're serious about it, so they can be better advocates for you in writing your letters of recommendation based on a resume that you have presented to them. And hopefully all the shadowing, and that'll come through and during your interviews, hopefully, and then they'll see the passion and how much you've done your homework and being around the profession. And hopefully that shadowing will lead you to be accepted into a program and ultimately be in a future new student orientation in your particular health profession field.
Thank you, Stephanie. Our next speaker is Jennifer Clutter from West Virginia University School of Pharmacy. Jen?
Thank you, Katie. So I'm going to speak about why you should be doing observation and shadowing experiences. Should you do them? A resounding yes, and that's why I put it in capital letters. I don't mean to shout at you, but yes, 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 you do want to do shadowing hours. This is really an opportunity for you to have a direct evaluation of this particular profession or subspecialty within the profession with your own eyes. We can learn about the profession in various ways, but being able to evaluate it through that direct experience, I think, is rather priceless in a lot of ways. It really gives you a more accurate day in the life perspective when you have the opportunity to sort of see maybe a dentist's day isn't always spent entirely with patients. Maybe there's record keeping, maybe there's billing, maybe there's other business management things and things of that nature, or with a pharmacist. Whatever healthcare profession, being able to see a day in the life gets you to show it, gets you to see it on a more holistic level. It's also the opportunity for you to be able to ask questions and to learn more about it that you might not be able to gain in any other with any other method. So the value, I think one of the values that's really, really large is motivation. I think it gets time. I know I remember when I was in undergraduate and in graduate school more recently, staying motivated whenever you are slugging it out in class day to day with all the other life activities that you have going on can sometimes be a little daunting. And so I've seen time and again when students that I've worked with who have gone and done shadowing experiences have really boosted their motivation. And by and large, it's also helped them to perform better in their courses. So I think all of those things are very, very good. Of course, it goes without saying, but I think it is important to note here, it is a basis for you to be able to make an informed decision. So you're kind of knowing what it is you're getting into. It's not like you just sort of, I'm just going to pick this. You really are taking a look and investigating it from, multiple avenues. The other thing, and I think this is something that often gets overlooked as an advantage of doing shadowing hours, and that is you have real life examples for interviews. Pretty much all of the professions are going to do some type of interview. I know for pharmacy, it is required for us to interview every candidate for our program. Other health professions may be slightly different. It will depend on the program, and it does vary from program to program. But my experience has been, by and large, because of each of the health professions and the real importance of being able to communicate, those communication skills are typically assessed in interview form. So you're going to be able to speak in an interview about current challenges that you see from the profession because you may have directly observed it in your shadowing experiences. You're very likely to have come upon a very compelling patient situation. So you're going to have a compelling patient story to share. And those things I think can really help you in the interview, certainly. Other value with it, basically you're getting more knowledge about the specific career pathway within the profession. So for example, if you're going to go observe a physical therapist that works with lower extremities, or a pharmacist that's working on a specialty unit, say with a transplant unit, or the cardiac unit, different things of that nature. A dentist who's an orthodontist rather than a general practitioner. Being able to kind of see the specific career pathway and that subspecialty within there is very, very valuable. It's also going to provide you with numerous networking opportunities, and that can really be invaluable in the short term and the long term. It provides a potential source for letters of reference. A lot of schools, and I'll just speak just for example for my school will accept letters of recommendation from healthcare providers, particularly a pharmacist in this case, and having that person be someone that has observed the student directly in the setting can be very, very valuable and provide a quality letter of reference. So it does give you the opportunity to identify additional people who can serve as references for you. And it also provides you with mentoring opportunities. These are people you're probably likely going to be able to carry on a relationship with them long into the future. They're going to know people in the profession. They're probably going to know people that are your faculty. Each of the health professions, believe it or not, despite this big universe that we live in, are actually very small communities. There doesn't take many connections to get from one person to another. And so those mentoring opportunities can help you to identify, other people that can help you get your foot in the door or help you with job opportunities, internship opportunities, or just simple mentoring and guidance that you may need throughout your academic and professional career. The other thing that it gets you is exposure to other health professions. We do not live in an isolated vacuum, okay? We are really providing the best patient care when we are all working together to address each of our individual specialty areas to the particular patient's needs. So you will be able to be exposed to other health professions, especially if it happens to be in a health center where you are doing those observation hours. The other thing, and I think this is very important as well, it can help you to identify those deal breakers, as I call them. Is this a profession that really probably is not the best fit for me? Is this perhaps a career pathway? I like the profession, but I don't want to particularly practice in this particular setting or with this particular subspecialty. So those things can really make a difference and save you a lot of money, time, and effort in the long run by being able to sort of identify those early on. The one thing I will say about that in terms of identifying the deal breakers, depending upon the shadowing that you do, if it happens to be shadowing for a day, remember that we all have bad days. For all of you on the line today, I really hope today is not yours. I hope you're having a good day. But you may be observing, and it may be a particularly bad day for that particular practitioner or with a particular patient problem that arises. And so make sure that you do ample investigation and observation so that you have enough of a breadth of knowledge to be able to make that determination. Other values basically that you can get from this is it can introduce you to volunteer, intern, or job opportunities. So in that networking that I talked to you about, a number of students that I have worked with, and I know my colleagues can attest to this as well, who are on the call, have experienced students who have gone and done volunteer experience or have done shadowing, and they've been able to volunteer, get internships, and job opportunities. So I know a number of my pharmacy students that have done shadowing have been able to ultimately land an internship at that particular pharmacy or in that pharmacy setting that helps them along within their career. It also can provide those required hours for admissions applications. And, other speakers prior to me have kind of mentioned that, and it can vary. Some schools will require them, some will recommend them strongly. Most of us are looking at applicants in a holistic way. And so being able to see a multitude of different things about that applicant, including those observation hours, is fodder for more information for us to use to make our decisions. It also can save you a small fortune. Education today costs a lot. It can range anywhere, between $20,000, $50,000 upwards of $300,000 or more, depending upon the health profession and the setting that you work or the particular school that you attend. So knowing ahead of time that by having these experiences and knowing you like it, that's good. You're making the right choice. If you haven't had these experiences and you're picking anyway, and then you get into it and you realize you're miserable, you've just wasted a significant amount of time, energy, and a significant amount of money in that investment. So really kind of having that educated decision by doing these observation hours is going to be helpful to you. So why do schools want to see these? We want to see these as admissions committees because we want to see that you're making an informed decision. Are you genuinely motivated to do this profession? Why do you want to do it? It shows a clear commitment to you, that you are doing this in a way that's very methodical and very well informed. So that is very, very important, rather than just randomly selecting it for, oh, I'm going to make a lot of money, and perhaps not have the motivation behind patient care and other commitments that we're going to want to see in students that enter the profession. It also provides additional evidence about you in the selection process. Again, back to those quality reference letters and that holistic admissions reviews and the value that it provides. And it basically gives you experience and exposure that you may not necessarily find in the classroom. So that's also going to be valuable for you. Some professions require these hours. So physical therapy, for example, that is a required component of admission to any physical therapies program. At the very least, it is very strongly recommended. I know my program doesn't require it of our applicants, but it is strongly recommended. And we do find that students that have had some type of experience in that regard tend to fare better on their interview and tend to look better holistically in the review of their application. So it ultimately makes you a stronger applicant. It can help open additional doors for you along your academic and career path. Again, it provides that strong motivation, especially during those high period stresses during school. And then it makes you a stronger applicant for future within the health profession that you're selecting. So I wish you all good luck and encourage you to get out there and see what it's all about.
Great, thank you, Jen. And our final presenter today is Douglas Watson, a pre-health counselor from Utah Valley University. Doug?
Okay, so I'm going to be talking about how to find a site, how I reach out and approach the schools. Again, I'm Doug Watson. I'm from Utah Valley University. I'm a pre-health counselor. I work mostly with pre-dental students and pre-PT students, but I have worked with pre-whatever else as well. I do get students all the time that'll come in and say, I want to be a dentist. And of course, when I ask them why they want to be a dentist or what makes them interested in that field, you always get the two big cliches that dental schools and other schools for that matter hear from all kinds of students. I want to help people and I love the human body. Well, that's not going to do it for you when you go to get into your schools. So it'll pay to have a little more information. I have them go shadow for that very reason so that they can have a little more to talk about. So things we'll talk about, challenges that you're going to run into. Where do you want to get started? Where do you want to go next and what the best practices are? Sometimes I laugh when I get a student that'll come in and say, I really want to be a physical therapist, and they've got an attitude kind of like what's on the picture there about what physical therapy is. It's really nice that you can get in and get a real true feel for this career before getting there, especially when you want to write a personal statement, you want references, as has been mentioned before, or of course, when you get to your interview, it's really nice to really have something to talk about when you're talking about why you want to be in this field. Some of the challenges you're going to run into, of course, the HIPAA issue is going to be a big deal, which is the Health Insurance Probability or Portability and Accountability Act. I'm making up my own acts now. And when that came in to play, it talks a lot about confidentiality, et cetera, and it puts some of the bigger facilities in a really big concern, or big, all of them are a concern, but the big ones have a lot more policies in place. We talk about confidentiality, liability, practices against shadowing. Sometimes your medical professionals are just too busy to be able to have all these shadowers from all over the areas. So obviously start with your network. Start with you. Do you regularly at least see a dentist, a pharmacist, a physical therapist? Who do you work with? Do you have somebody that you have a relationship with that you can say, hey, can I come shadow you? I'm thinking I want to do it. You did such a great job with me. Now I want to go do it with others. Remember, these people have been there. Next, look with your family and your friends who are in the field, closely related. Maybe you've got somebody in your neighborhood, your community, your church that does this field that can help you out. Or maybe, as I say, closely related, maybe you're looking to work with a dentist, but you know an orthodontist. Great. Orthodontist, shadow the orthodontist and get started that way and work from there. Do you just, don't just look for paid opportunities. Oftentimes I have students that say, boy, I really want to get my hours for physical therapy, but I just want to get paid. Well, those opportunities are few and far between. Again, if you're looking for the larger hospitals, large group practices, things like that, they're going to have a lot of roadblocks like background checks, shots, things like that. So it's going to take a little longer to get those rolling. Also look for rural clinics, VA hospitals, as they tend to have less requests and they also tend to be more open to helping out. Again, don't be overbearing when you're in your shadowing experience. You don't want to be that person that everybody's looking at saying, boy, don't invite him back, don't invite her back. They're not going to make this work. You want to make this relationship great, so they invite you back for more hours, and you can use them as a reference as well. Also, be professional. A little professionalism goes a long ways. As you're a professional, if I've got a student that has only done 2 or 3 hours at a certain place, I wonder, why didn't you go back there? Make sure you get back to these places and build relationships so that they're welcoming you back. If you do a good job when you're shadowing, places are more apt to bring you back in to talk to you more about it. Again, check with local practitioners. If none of your other inside circles or your personal relationships, none of those bring anything, well, now you've got to go find a place that you can shadow. Don't cold call. If you just go on the phone and start calling places, you're going to run into a big bunch of roadblocks. You want to show up and you want to be dressing and acting professionally. Don't be demanding about hours, pay, etc. Let them know you're hoping to be this because they were in your shoes not too long ago. They know how this feels. You've got to be persistent. Again, it's a big deal. I have students all the time that'll say, boy, I just couldn't get my shadowing going. And I find out what they were really doing. And I find out they were really good on the Xbox during that week. If you're really, really persistent, you're finding your way in there because we have enough students that are finding their way. Again, prepare some sort of letter that introduces you to the career. Try to avoid the V word. Volunteer will get you handing out wristbands outside the OB ward. When you really want to, the S word, shadow a PT maybe. Also check with your pre-health advisors. Oftentimes these offices have contacts that will share with their students. I've had in the last 3 days since I started practicing this run through, I've had 3 different PT facilities that have said, hey, we're hiring or looking for people to do an internship or a shadow experience. Do you know any students? I'm able to send that out to my students so they can see what's going on. Also, you're usually the first one to hear about Share a Smile or Special Olympics or pro bono clinics that are happening in your community. Usually those advisors have those kind of research or resources and have felt those things out. Also, check with your local schools. If you've got health profession schools in your area, some are going to be great about it. Some are going to be overburdened with it because, as they say, as we've heard from a couple of the other speakers, we have too many and we'd be just shadowing all the time. We'd be overwhelmed with shadowers. So there's a balance to it. But if we have in Utah 2 or 3 schools. If you're looking for PT, we have 2 schools in the state that you can go to. And one of them has a pro bono clinic that works with our students very well. Another one has another clinic that you can get involved with as well, but you have to kind of go through the school and it's a little more limited. So look at these kind of things because the schools have things going on. Maybe you have a dental hygiene program in your area that you could go shadow at least and get a start. Again, start with baby steps. Some best practices: get your foot in the door. Again, baby steps. Start small. Don't try to get 2,000-hour internship out of the chutes or a paid position. Once you've done some shadowing, it's easier to get more, assuming you're professional with your first shadowing. After you've taken some of your prerequisites, then you're more marketable. I have some places that say, for PT students, for example, after you finish your anatomy and physiology, we know you're a little more serious about this, and we're going to set up an internship rather than just a small shadowing. But that brings possible paid and other things, opportunities. Utilize early shadowing experiences to get networking of different settings. So you've shadowed a dentist. Now you want to look at a oral surgeon. Well, maybe talk to your dentist and find out if they know an oral surgeon because they've been probably working in the field for a while and know others in the field. Again, possibly start with something else to get your foot in the door. Dental could start by being a dental assistant. PT could start with a senior center who has a PT visit. Most farm students at my school work as farm techs. These are great activities to get warmed up to healthcare.
Great. Thank you, Doug, and thank you to all the speakers. For the remainder of the time, we have a few questions that we want to address to the speakers. So first question, how do I get my hours verified?
I'll jump on that. The verification, it varies by school and by situation. For PT, it's a big, huge deal. It must be verified. Almost all the schools, I would say, in fact, I think I have statistics about, it looks like out of the 231 programs that are in the game, there's only 10% that shadowing hours are highly recommended. The rest of them want them and they're required. But for PT school, APTA is going to have you in the PTCAS application. You're going to put in the names and information of all the people that you shadowed, and it's going to send them an email. You want to follow up with that, make sure that the email doesn't go to their spam or anything like that, so that they can get it and verify your hours. You're actually going to put in what hours you've done and what hours you're planning to do, and in each individual area. So it's going to pay to record this stuff as you go. For schools like dental school, there's a spot on the application for your experience. And in the dental school experience world, you're going to want to be able to show, they're going to be able to know if you've done it or not by your experiences and by the way you tell what you've done. Hopefully that helps that way.
Yeah, let me add to that, Doug, again about dentistry. And so it's not in stone where you need a verification, but you're right. Those of us that interview and review applications have been doing it long enough where we look and if they're going to ask where was this practice, who was the dentist, then it's easy enough. If we're not convinced that you actually did that time, then it's easy enough for us to email or pick up the phone to get our own verification. So where the DIA doesn't ask for it has to be verified, you don't want anybody to question that did you fabricate some of these hours or some of the time, because during our interview, there will be questions that will be asked. So you can have some verification there, some confirmation about that exposure that you did during your shadowing or working experiences. Also, it'll flow in your personal statements. So if you've had some very innovative things that you were able to observe, and sometimes they write about it in their personal statement. So if you say, I've shadowed 500 hours, and then you mention nothing about exposure and watching of dental procedures, then that's going to be kind of suspect for us in looking at that, and so you may be questioned. So just make sure that whatever you put on the application that you can verify it during conversation for an interview, or it could be a make or break, for the admissions committee with you.
And this is part 2 of that question, but do the hours have to be verified?
I would.
No.
Go ahead. Sorry.
I was just jump right in there. For dentistry, no, but just why? I mean, why put that trick in there? And because they're, honestly looking for reasons for you to stay in the pool, and then looking for reasons for you not to stay in the pool. And so for you to falsify some things, just to fabricate it, is just not a smart decision. But for dentistry, you don't necessarily have to verify, and you don't necessarily have to have a signature. It's just simply just best to have more than less.
PT school has a verification system as part of PTCAS, so make sure you get those verified.
Yeah, I'll jump in here too. What I think is really important, and which is kind of key, and I know several of us have mentioned it earlier, you want to do your homework about the schools that you're applying to. One school that you're applying to may require them be verified, another school may not. And so being able to know that clearly will help you. So it's best to kind of do that research ahead of time. But in general, what I would recommend to any student would be to maybe keep a journal or a diary where you are sort of recording your hours, the dates, times, and things like that. At the very least, it's going to help you immensely when it comes time to fill out those details on the application when you apply.
Great. Next question I have is, what happens if I'm having difficulty finding experiences?
That's
I guess coming from, sorry.
Go ahead, I'm sorry.
Coming from a pre-health advisor, I would suggest go see your pre-health advisor. They should have some options. Most schools that I've talked to across the country, as I sent out information prior to doing this, I asked other schools saying, what do you do for your students? The real answer was, you go see your pre-health advisor. They can usually get you set up. Not necessarily will they find you a place, but they know how to tell you how to find a place in your area.
One thing I wanted to add with that, it just has to happen. There's no way for a program to think that you know what you're getting into if you hadn't surrounded yourself and been around it. So it's essential. It has to happen. I have some students who will come to me. So you can also notify the program, the dental schools or the PA schools, the pharmacy schools that you're interested in. So if you contact them, I have a list of dentists who would say, and if you go in, if you cold call, they may not take your call, but if you say, hey, I was kind of forwarded or recommended by the admissions office at the dental school, and then they may have a change of heart. So that's in a way of desperation. We do have a list of dentists that are more willing to take people which we've sent. And so, like Doug was saying, you can also get them if they were sent by your pre-health advisor as well.
Yeah, the one thing I would also add to this is some students will get frustrated, but they may be trying to do it in a place where there are a lot of students perhaps seeking similar activities. So, for example, I'm based on the Morgantown campus here in West Virginia at WVU. So we have most of the bulk of the pre-pharmacy students studying here in Morgantown. We're going to get applications from here and all over, but if you think about the number of students trying to seek opportunities just here in Morgantown, it might be a little more challenging. So several students have found that when they go back home for breaks or holidays, summers and things of that nature, they may be much more successful in setting up those experiences at that time rather than perhaps where it is you go to school, because you may be competing against a larger group of people trying to seek similar experiences. But just be persistent, keep trying.
So you mentioned keeping a journal or keeping an Excel document with the hours, but what should I track from my observations?
I would tell students to track everything they can. I mean, when you think about it, when you go to this event, you can track the date, the time, the place, the person you were with, those kind of things which you've already talked about. But things that help them later when they're writing a personal statement or when they're presenting or interviewing is possibly write down some kind of a diary of what did I see? What did I learn? And one of the big ones that I always tell students, what did I feel while I was there? Because when you feel something and have an emotion with it, you remember it a lot longer.
I simply want to add to that was that in that you have shadowing, and then to me you have what I call quality shadowing. And those are usually, sometimes you have a health profession who's a great health profession, but they're not necessarily a great mentor. And then that's when you have to choose, do I stay and spend lots of hours with this person, or do I move on or add somebody else in the mix of that? Because the last thing you want to be is to be with someone who's very kind of not let you up and close and personal with what's going on, and you don't get a realistic feel for what this health profession is. And then you get in that program, and then you're not satisfied because I didn't know this what it was, because I didn't have that exposure. So monitor your shadowing experiences as well.
And is paid work okay?
Paid work,
Yes, different feel.
yeah, it is okay. Although many of it, we're looking for students who are altruistic because you're going into a caring profession. And so how do we evaluate if you care or not? One of the ways that we do that is to see, have you been doing experiences outside the classroom, on your own time and things of that nature. And so it could be interpreted that unpaid is more altruistic than those that get paid. But that's not always the hard and fast rule, but just keep that in mind as you're looking at things.
I also wanted to add that when you're talking about, please never not accept a position or shadowing that opportunity because it doesn't have pay. Because at the end of the day, instead of having you hanging around asking questions, they could actually hire somebody who has more experience. So at the end of the day, a lot of times you shadow, and then you come back and you shadow again, and 1 week turns into 1 month, into 6 months, and then they kind of know that they've kind of grown you into a good healthcare profession, and then that's when they feel confident. It's kind of like on-job experience, and then you look up and voila, you've been hired because now you've gotten this experience, and now you kind of earned the right to have this exposure. That you got the exposure, you have the experience, and you guys can help each other out. But at first, you're just going in and trying to learn more. So at some point in the beginning, oftentimes you shouldn't be paid because you won't be bringing experience or anything to the table for them.
Great. Well, if you have a question that was not answered today, please make sure to reach out to the association of the profession you are interested in for more information, and we'd be happy to answer any of those questions. Thanks to everyone for your time today. We hope you learned some valuable information that you can take forward with you as you prepare for your future career. And as a reminder, this webinar has been recorded, and the recording will be shared with all registrants and posted in appropriate locations in the near future. Thank you.